Okay, let me repeat. So, we are going to talk about overdose. So, what's overdose? An overdose is when you take more than the normal or the recommended amount of a certain substance, and it's usually a drug, and it may result in serious harmful symptoms or even death. Now, if you take too much of something on purpose, this will be called an intentional or deliberate overdose. But if the overdose happens by mistake, then we call it an accidental overdose. So we're going to go over four types of overdose mainly: the alcohol overdose, opioid, benzodiazepines, and the stimulant overdose. Starting with the alcohol overdose, it is a major cause of poisoning, which is actually going to be the binge drinking. So, binge drinking is a pattern when there's usually heavy drinking. For example, when a male is going to consume 5 or more alcoholic drinks within 2 hours. Or actually, a female also, when she rapidly consumes 4 drinks within these 2 hours, this is considered as binge drinking or alcohol overdose. So, what are the symptoms? They are going to manifest as marked mental confusion, difficulty remaining conscious, or sometimes you could be completely unconscious, lack of responsiveness, or not being able to be aroused or woken up by others, seizures also, vomiting, and this will particularly be dangerous because it will give a potential for the diminished gag reflex, slowed or irregular breathing, when the heart rate is going to slow or stop, very low body temperature, and a pale, clammy skin. Clammy skin means it's wet because of sweating. So, moving on to the opioid overdose, we know that the opioids can be used in a medical case, for example, for pain management, such as morphine. But if we have some non-medical use or misuse or prolonged use, these are all can lead to the opioid dependence. Now, according to the WHO, about 0.5 million deaths are attributable to drug use, and more than 70% of these deaths are related to opioids. One third of these numbers is caused mainly by opioids overdose. Now, what are some risk factors for this overdose? If you, for example, if you're using opioid, however, without a medical supervision, this can lead to overdose. Being a male, unfortunately, people of older age and people of low socioeconomic status are at higher risk of opioid overdose rather than females and people who are basically in a high socioeconomic status. Now, you may wonder why are males more prone than females, and this is because of some societal and biological differences, how the female body handles the drug and how the male body handles the drug, and on the other hand, some society stigmas, etc. Now, how do you know that you're suffering from opioid overdose? These are the following symptoms. We have loss of consciousness, constricted or pinpoint pupils, breathing difficulties, respiratory arrest, choking, snoring sounds, blue lips or fingertips, and also being unresponsive. Now, what are the benzodiazepines? Benzodiazepines, they are also going to be known as the benzos. These are the central nervous system or the CNS medications that are going to depress the CNS. So they're known as the sedative hypnotics. So they are basically prescribed for the management of any short-term anxiety, insomnia, seizures, and other muscle spasms. But benzodiazepines, of course, carry with them the potential of misuse, addiction, and deadly overdose. Now, especially if you're taking this benzodiazepine with alcohol or with opioids or other substances, so whenever you're going to take this in a combination, this can increase the risk of having this overdose, etc. Now, what are the symptoms of the benzodiazepine overdose? You are going to have slurred speech, marked confusion, impaired mental status, coma, and slowed labor or breathing arrest. Now, what are the long-term effects of overdose? They may include organ damage. As we know that usually the drugs are going to be metabolized by the liver, so this can damage the liver, impaired cognitive and motor skills, and this is because, as we said, some of the drugs are going to affect the central nervous system, coma, psychological problems such as depression, anxiety, and PTSD. Now, we know that depression can lead to overdose, but overdose can also lead to depression, so it's the other way around as well. If a person survives an overdose, He may also suffer from memory, learning, and behavioral problems. So how do we treat this overdose? First, we are going to give some medical treatment. There's a medication known as naloxone. Naloxone is going to be given to reverse this opioid overdose. And also we can provide some supportive care such as oxygen and IV fluids. We already said how people having overdose can suffer from breathing problems, so they might as well have problems in their oxygen levels, and that's why we should give them oxygen. And of course, we must monitor the mental signs, the vital signs. Vital signs are basically the blood pressure, the heart rate, the respiratory rate, etc. So we must monitor all those. And of course, if we find that there is any problem, we must act accordingly. Now we have some physical treatment as well. For example, placing the person in a comfortable position, like on their side if they feel better, keeping them warm, and stimulating the person if he becomes unresponsive. Okay, so there's also the psychological treatment. We know that these people have suffered a lot, so we must provide emotional support to the person in distress. Connecting with the poor person with available resources and treatment options. We must help the person identify what is the underlying issue. It could be a substance use disorder, for example, and of course, give them a referral. Now, how do we prevent having this overdose? It is very important that we must know the signs of overdose to know if we're suffering from an overdose. So we must recognize them on ourselves or if someone else is having an overdose. And in case there's an overdose, we must definitely seek help. Could be due to the medical attention or call the 212. We must stay hydrated. Dehydration increases the risk of overdose. And of course, we don't hydrate ourselves by drinking alcohol or caffeine, it's usually water. Avoid using them alone, the drugs, I mean, if you can't recognize the signs of overdose. And definitely be aware of the risks. Don't mix substances together. Whenever you're on certain types of drugs, you must pay attention and you shouldn't be mixing them with something else or taking alcohol at the same time, etc. In Lebanon, there are some referral centers. There's, for example, Nosroto, and here is the number. Also, Sukun in Badaro and Umm Noor. Now, Umm Noor is it basically has two places, two rehabs in two different areas. One for males, it has a capacity of 72 patients, and one for females, it has a capacity of around 36 patients. Now, I would like to just talk a little bit about the stimulant overdose. So stimulants are something that stimulate or speed up the body. They include, for example, cocaine, amphetamines, and caffeine. And these can manifest as jerking, seizures, hallucination, chest pain, anxiety, and increase in temperature. So as a wrap up, we defined what is basically overdose. We also talked about the different types of overdose, how they are going to manifest, how can we treat them, and how should we try to prevent entering this condition from the beginning. And here are some centers to help a lot of people. And basically that's it. Those are the following resources I have used. If anyone has any questions or anything that you would like to add. I hope this was helpful. I will stop sharing the screen. Okay. Great. So again, if anyone would like to know anything, please ask me. All right. Thank you for watching.